And Caitlin asks, what are your thoughts on prolotherapy or sclerotherapy for pain relief to treat chronic back pain, which is used by some chiropractors along with some osteopaths and medical doctors? I don't know that chiropractors are doing prolotherapy. It involves injections, and I don't know of any state where chiropractors are licensed to use injections. Now, sometimes chiropractors have multidisciplinary practices. MD, DC practices are more and more common. They're not in the majority, but that's a niche within chiropractic where you'll hire MDs or get into some sort of partnership with a medical doctor or osteopath, and they'll take care of the medical end of the practice and you'll take care of the chiropractic end of the practice. So I imagine those are the kind of practices where you would see prolotherapy. Prolotherapy or sclerotherapy. Prolotherapy is a newer term for sclerotherapy. I don't like to talk in any depth about things that I'm not very familiar with, and I mean, I know about it. The idea is that you do this injection, usually it's dextrose and saline or something that's going to cause some inflammation in the tissue, the damaged tissue. I could see this as a possibility, especially with car accidents, where a lot of the injuries are permanent. When you tear a ligament, it's pretty much a permanent injury. It creates a permanent instability and causes what's called post-traumatic arthritis, where that instability, after a while, it's causing degenerative changes to occur in the cartilage. Eventually, the bone will actually change its shape and grow bone spurs and negative things like that. So prolotherapy, I've done a little bit of reading on it, and there are pros and cons. There are people, of course, the people who advertise it are all for it. They're talking about 90% success rate, 85 to 90% success rate, which is extremely high. Others say that, that basically the jury isn't in on it yet, that it requires more research to see how really effective it is. And now they're using also stem cells. And the idea is, early on, the idea was to create scar tissue, to make the area more stable. But of course, there are problems with scar tissue. Those areas tend to be more sensitive, more painful. They also limits motion, whereas the newer applications of it supposedly cause regeneration of normal tissue, which would be wonderful if that's exactly what happens. So I've not sent any patients out for it. People have told me they've gotten some results with it, but I'm not sure. You could probably learn more about it by reading about it on Google.